I get there. Good morning, everybody. My name's Donna Gans. I'm the National Nurse Manager with Lymphoma Australia. And thank you for joining us right across Australia again. Thank you for your support. This morning and next Wednesday, we're very pleased to bring you the Living Well with Lymphoma and CLL series, where we'll be focusing on why exercise is so important and how to incorporate this into your life despite your lymphoma diagnosis. There's a little bit of housekeeping. If you have any questions throughout, please click on the icon at the bottom of the screen there. It says Q&A. You can leave your questions in there and we'll be answering either throughout the presentation or we'll be definitely leaving to the end at least. And during the presentation, we'll be also having some polls that Dale will be putting up where you can which will ask you questions, so you can click on the answer that's most relevant to you by using your mouse, okay? Look, we're really pleased to welcome our special guest, Dale Ischia, who is an accredited exercise physiologist and specialising in oncology. Dale has more than 20 years of clinical experience who's specialised in oncology over the past 7 years. She founded the Moving Beyond Cancer, which is an exercise physiology program dedicated to improving the lives of people with cancer diagnosis through appropriately prescribed exercise. Since her cancer exercise specialist qualification with the American College of Sports Medicine, Dale has provided her expertise to many private clients and organisations, including many leading Australian cancer organisations and support groups. Dale applies the latest research findings to her clinical practice to provide her clients with the most up-to-date education and exercise prescription to help minimise the side effects of cancer treatment and give people a sense of control over their bodies. Welcome, Dale.
Thank you. Thanks so much, Donna. Thanks for having me, and thank you for joining me, everyone out there. And thanks to Lymphoma Australia for inviting me to speak today.
Oh, thank you. I'll let you get on. Thank you.
Thank you. Thanks, Donna. So today I'm going to talk about the whys of exercise, why you should exercise, why it's important to you. And I assume if you're here that you already have some idea that exercise is somewhat good for you. I'm going to touch on a little bit of the research. I'll just sort of gloss over the research a little bit, but I've got a few research papers to talk to you about. And if you want me to go into further detail, you can ask some questions. And I'm also going to talk about what is recommended in terms of exercise. So that's the plan for this week. And next week, we're going to go more into what's involved in an assessment. If you come and see an exercise physiologist, we'll rate your strength and balance, talk a little bit more about cancer-related fatigue and the common barriers to exercise and how to overcome them. And then next week, if we've got time, we'll go through some gentle exercises. So I am at home right now, sitting in a room by myself, talking to you out there. So it's really nice if I can have some sort of interaction with you and some feedback. So I know I'm not talking to myself. So I've included some polls in our presentation today. So hopefully that all runs smoothly. So I really encourage you to answer the poll questions. There's absolutely no wrong answers. And it's just really interesting to see where you're coming from in terms of the answers, and I'm sure everyone else would be interested to hear the answers as well. So please don't be shy and answer the polls. So, why can I not skip forward? What's going on? Oh, hang on a minute. That is odd. Here we go. Oh, there we go. So the first poll we have, let me just set this up, is I'm launching the poll now. So you just need to click on which is most relevant to you. So which side effects from treatment do you have or have you experienced? And it's a multiple choice. You can answer as many of these as you like. Now, for some reason, absolutely. Oh, there we go. People are answering. Yay, thank you. So I'll just let you give you a little bit of time to answer those questions, and then hopefully at the end of the few seconds, we can see what everyone has answered. So typically fatigue, I think almost everyone that has answered, fatigue is the most common. So that is typical of research and what we understand. So I think I'm going to end the poll there. So, oh, here we go. I think I can share the results with you. So now you can all see these results. So of the 10 of you that answered, thank you very much. Fatigue is the most common side effect, which is very typical. Loss of muscle mass and strength and general deconditioning. So I'm going to talk a little bit more about that. So I'm just going to turn that off. And yeah, next slide. I can't seem to progress the slide. Here we go. So we've sort of touched on in that question the common lymphedema, common side effects of treatment for lymphedema, which is fatigue's most common. Balance issues, which a couple of you ticked, loss of muscle mass, weight gain or weight loss, nausea, vomiting, cramps. Actually, I've just got another poll question for you. So this question, what do these side effects have in common? They suck. They can all be helped with correctly prescribed exercise. They can affect the quality of my daily life, or all of the above. So please answer away. If we can get at least half of you answering these questions, that would be awesome. Wonderful, thank you. Even more of you answering this time. So there you go. Pretty much all of the above, and can affect the quality of my daily life. Absolutely, absolutely. And that's what we're wanting to talk about today, is improving that quality of life. So not only, you know, the cancer itself and all the treatments that you go through create this massive deconditioning effect. And there's this nasty statistic that says 12 weeks of chemotherapy is similar to a decade of decline in your cardiovascular fitness. And it's not only your cardiovascular deconditioning, but it's your musculoskeletal deconditioning, your neurological deconditioning. So the best way to reverse or delay or stop this deconditioning process is through exercise. So this is a flyer that I created some years ago now, and I've updated it a couple of years ago. So it used to be how exercise can help counteract the side effects of treatment. But now I'm really excited that I have been able to add to this that it can also improve, exercise can improve your immune function, improve your tolerance to treatment, and improve the efficacy of treatment. So I'm going to touch on a little bit of that with the research that I'm talking about. But what studies have shown, so all these statements are evidence-based. So for example, having good muscle mass is really important for someone going through cancer treatment. Studies have shown that the greater your muscle mass, the increased chance of survival. So doing exercise that improves your muscle mass is very important, and it improves your function as well. And it can also improve those arthralgias, so that joint pain and muscle pain you get is really important. Also, treatment can cause a metabolic syndrome, which is more relevant if you're on hormone treatment, which you guys would not be. Bone loss as well can be a side effect of some treatments, so exercise is very important to help that. Exercise is the best treatment when it comes to cancer-related fatigue. And I believe I'm showing you some studies relating to that, and we'll talk more in detail about that next week. It improves balance. There are recent studies about peripheral neuropathy. I think a couple of you mentioned that as a side effect. Exercise can help with peripheral neuropathy. It's not given that it will help, but it can help, and it certainly can help with the loss of balance that is associated with peripheral neuropathy. And there's also psychological benefits of exercising, doing something that you can control, that's something that you're in charge of, is very beneficial. So exercise is so beneficial for people going through cancer treatment that it's now recommended by the Clinical Oncology Society of Australia. So it's embedded as part of the standard practice in cancer care, and which includes a referral to an accredited exercise physiologist, an AEP. That's me and many others around Australia with a cancer experience for targeted exercise prescription. So I just wanted to whiz through a few research papers. So this was a randomized controlled trial of 122 lymphoma patients. They did 12 weeks of aerobic training and they showed improvements. So a randomized controlled trial means that it was split into two groups, and one was a control group and one was exercising, doing aerobic exercise training for 12 weeks. And those in the exercise group showed improvements in fatigue, physical function, quality of life, happiness, cardiovascular fitness, and lean body mass. So these are all really important, not only for counteracting side effects of treatment, but also improving survival. So this was a systematic review, Cochrane systematic review, which means that they get all sorts of different papers together and they have a look at it. So what is the benefit of exercise in hematological cancers? So which lymphoma is one of them? Improves quality of life, especially physical functioning. Improves depression, which is really important and often presented in combination with fatigue, and improves fatigue levels, which is really exciting. This slide shows how exercise can have an effect on your natural killer cells. So natural killer cells recruited into the bloodstream during exercise, and their main function is to kill infected or transformed cells like malignant cells. And then mobilise within minutes of intense exercise, and maximum levels are achieved at about 30 minutes of intense exercise, and after 3 hours there's a decrease. So there's this dose response of what is the best amount of exercise to maximise your immune response. So yeah, as I said, dosage is important. We've found that regular moderate exercise training improves your immune competence or function, but acute, intense, prolonged bouts of exercise can temporarily decrease your immune function. So doing too much for you, and that's going to vary from person to person. It's quite different depending on who you are and what your fitness level is. But simply moving helps the flow of lymphatic fluid. So doing something is better than nothing at all, but there is a point at which you can do too much. This was a nice little study, only 35 participants, but using bed exercise for people undergoing a stem cell transplant. So 18 of the patients did bed exercise for 30 minutes every day for 6 weeks. And obviously there was a control group that didn't do the exercise. And they found that those in the exercise group, their lymphocyte cells increased by 40, and those in the control group, their cells decreased quite significantly. So even whilst undergoing the stem cell transplant. Now, this is, so there's plenty of data showing large retrospective studies, so that's looking into the past, that regular exercise improves cancer survival and also reduces cancer recurrence. And we know that exercise can improve immune function, and that exercise also reduces inflammation. And there's emerging evidence to support this in cancer. These pictures are showing lots of studies that are going on at the moment in mice to compare exercise and not exercise in solid tumours. So this image up here, I don't know if you can see my mouse, but that ghastly looking pink and black one, this is the control group. And the black cells are cancer cells, and the exercise group are showing these biopsies are showing that there's a lot less tumour cells in the exercise group. This image A is showing, comparing the sedentary group to a control group, again in mice, right? So mice were injected with tumour cells, and they were asked to run on a treadmill, a little wheel treadmill thing like in that image there. And those that exercised had a reduced tumour volume after a certain number of days of having the tumour. In this slide B, we've got the green cells are showing apoptosis. So apoptosis is a process that happens in our bodies all the time, and it's basically when your body recognises that a cell is not doing what it should do, it kills itself essentially. So this is showing that those in the exercise group, apoptosis increased, and which is an awesome thing. Also, they were looking at, so all of these are solid tumours, obviously. With this, there was a study in pancreatic tumour patients that the exercise increased the vascularity of the tumour. So basically the blood volume was able to the tumour was increased. Therefore, the theory is that the chemotherapy can bathe that tumour more deeply and thoroughly because the exercise has increased the blood's ability to get to that tumour. Oh, okay. So we've got polls. I would like you, please. Oh, sorry, I didn't stop sharing that. I would like you to now rate your overall fitness prior to your cancer diagnosis. We're also, the next poll we're going to have is you rating your fitness now. So we're going to compare. So please, if you can rate your fitness between extremely poor, pretty terrible, mildly terrible, below average, average, good, and very good. And there's got to be more that I can't see there. There we go. Excellent. Okay. Elite. Oh, a few excellents. That's great. Good, average. Okay. Oh, I'm pleased to hear no one's, oh, this is prior, of course, prior to your diagnosis. So everyone on the whole felt that their fitness was not too bad. Okay, so I'll just have a look. You can all have a look at those results. So as you can see, good was the most common response there. So now I'd love to compare that to how you're all feeling now, your overall fitness. So if you can answer that now. It's interesting that people rating their own fitness is a really good indicator of where you're at. People are usually pretty honest and unsurprised by all the tests that we do in our assessments, that they're usually pretty well where they thought they'd be. In some cases, some people are better than they think. Okay, so yeah, it's across the board, we've all sort of moved down and reduced our perception of our own fitness, that's for sure, which is totally understandable if you're going through treatment. Okay, thank you. So I'll just share those results with you. Great. So that is interesting. So the average was good and now it's below average. Okay, so I hope I've convinced you all to exercise. So what is the recommendations? So as we know, exercise, it's part of the best medicine. It should be part of everybody's cancer treatment, and it is safe and feasible across the cancer continuum. And actually saying that, when I was talking about those mice studies before, like it's in mice models. Now they've done a couple of studies in humans whilst they're going through chemotherapy, doing exercise during the actual infusion process, and they've concluded that it's safe and feasible actually exercising during chemotherapy. So there's going to be a lot more studies coming out that are not just mice models, that they're human models, so we can get more of an understanding of the benefits of exercise actually during chemotherapy infusion, which is really exciting. Anyway, back to this slide. So it's completely safe across the cancer continuum, meaning prior to diagnosis, obviously, throughout treatment, even during a stem cell transplant and beyond. And it should be part of everyone's cancer care. So the dose of exercise that is right for you is the mode of exercise. So your mode of exercise could be walking, bike riding, dancing, resistance training, and we multiply that by the intensity of exercise, the frequency of exercise, and the duration of exercise. And I'll talk a little bit more about that. But the overall arching umbrella guidelines is 150 minutes per week of cardiovascular exercise. So that is 30 minutes 5 days a week, and 2 to 3 strength training sessions per week. So this is not taking into account anything to do with the person themselves, but this is just the general guidelines of how much exercise someone with a cancer diagnosis should be doing. I would say, yes, this is lovely, but we also need to consider, there's lots of things to consider, which I'm going to go into more detail next week. So the cardiovascular, I'm just going to elaborate on that. The cardiovascular recommendations is that we have at least 150 minutes of moderate to vigorous activity per week. So that's about 30 minutes a day. So thinking about that natural killer cells slide, we're aiming for around 70 to 90% of our VO2 max, and that should be increased a little bit. In some studies, it's shown that actually doing more than that reduces your chance of recurrence. And we want to gradually, depending upon where you're at right now, we need to gradually increase duration, frequency, and intensity, and in that order. So if you can only walk for 5 minutes every day, rather than increasing the intensity of that 5 minutes, you should try and increase the duration of that walk first. So increasing from 5 minutes to 30 minutes, and then you try and increase how often you can do that. So for example, walking, running, cycling, swimming, or rowing. Now, swimming might be an issue for someone with low immunity. So you need to talk to your, refer to your blood test results, whether that is relevant for you at the time. The strength training guidelines, so 2 to 3 strength sessions per week for major muscle groups, moderate to vigorous intensity as well. Using multi-joint exercises is better than single joint exercises. Oh, why did that skip forward? Help. We need to begin with 1 to 2 sets of 8 to 15 repetitions of 6 to 10 different strength training exercises, and progressing on. So you're increasing the weight, reducing the number of repetitions, and increasing the sets. This needs to be under strict supervision if you were to have bone metastases, for example, or other joint issues, or tendon issues. Tendon issues seem to be very common in people that have undergone chemotherapy. So strength training needs to be really well supervised, especially for technique as well. So intensity, what does it mean? What's moderate intensity? What does vigorous intensity mean? So moderate intensity is around 55 to 70% of your maximum heart rate. And your maximum heart rate is 220 minus your age. So this is all very well and good, but when you're going through chemotherapy, it's typical that your heart rate is elevated both at rest and during exercise. So it does mean that your body is working or your heart is working a lot harder. So another thing we use is the Borg Scale, which is on the next slide. I'll show you in a sec. Or you can use the talk test. So you can talk, but you can't sing. And it's things like walking, hiking, biking, swimming, dancing. Vigorous intensity is you're really sweating. You can't hold a conversation. You're actually working really hard. And this is evident in our Borg scale here. So Borg perceived rate of exertion scale. So 6 is rancho relaxo, totally resting. We should all be on a 6 right now, or 7, unless you're riding a bike while you're listening to me, of course. And then 20 is pushing yourself so hard, you're about to pass out. So a moderate intensity is around this 12 to 14, somewhat hard. You're getting your heart rate up. Whereas vigorous is you're getting your heart rate up quite a bit more. You feel like you're working quite hard, you're sweating, and you can't really hold a conversation. So next poll question. So we are going to go to, I would like to know who of you out there is meeting these exercise guidelines. So you can answer a couple. So are you meeting the cardiovascular guidelines of 150 per minute week, 150 minutes per week only? Are you meeting the strength sessions? Are you meeting both strength and cardiovascular minutes per week? Not even close, but I'm working on it, and not even close, and just don't talk to me about it. So it's good to know where you're at right now. Okay. That's interesting. No one is doing any strength work. But actually this is, so I'll just end the poll and I'll share you the results. So 4 out of 17 of you are meeting that cardiovascular guidelines. Oh, sorry, a few of you are meeting both strength and cardiovascular guidelines. That's great. Not even close, I'm working on it, is the majority of you. That's good to hear that you're working on it, and not even close, can't contemplate it. I totally get it. Totally get that as well. But what we have noticed, especially during COVID, is that people are doing a lot less strength training because the easiest thing that you could do is go for a walk. So that is great, but it is really important to add the strength training to your program. So I'm just going to ask you one other question today. So this is our last question. What would you hope to achieve by increasing your daily activity? Do you want to cope better with treatment? Do you want to improve your balance, improve your immune function, reduce your fatigue, increase the efficacy of treatment, so how effective your treatment is, or improve your strength and condition in order to cope better with daily life? So there's a wide across the board, cross section of responses here. That's wonderful, thank you. I think there's about 17 of us answering regularly, so I will share that with you. So that's really interesting to see. Most of you want to improve your strength and condition in order to cope with daily life better. So that being said, I'm going to make sure I look at those exercises that I'm taking you through next week and make sure there is some decent strength exercises in there. Improve balance as well. I've got a couple of balance exercises in there, so that's great. And reducing fatigue, we'll talk more about that next time. Awesome. So we need to establish the correct dosage of a combination of the following modes of exercise. So modes of exercise: weight resistance exercise, cardiovascular exercise. And sorry, I've just realized that I've left my little picture there of sometimes I laugh so hard the tears run down my legs, because I often talk about pelvic floor exercises for men and prostate cancer. So that is not relevant to you guys, but perhaps it is, who knows. So there's targeted exercise as well, doing range of movement. impact exercise if bone health is an issue for you, and balance exercise is most likely an issue for a lot of you. Balance is one of those areas of fitness that is often forgotten about, and we talk all about resistance exercise and cardiovascular exercise, but balance exercise is really important. People find themselves falling over, especially when they're going through chemo, you know, bumping into walls and that sort of thing. So, and if you also have peripheral neuropathy, your balance can be affected. So we certainly incorporate and encourage balance exercises. So each cancer journey for all of you is different. Everyone's got pre-existing conditions and other health issues, comorbidities are like, you know, diabetes or heart condition, that sort of thing. Your diagnosis and prognosis is going to be different, and people undergo different treatments and have different side effects to those treatments. Every response is individual. So we need to tailor your exercise program to the individual, which is why I would encourage you to see an accredited exercise physiologist yourself, so you can you know, experience the, you know, getting the exact exercise for you. Sorry, I'm thinking about what I'm going to talk about next week. I'm trying to hold myself back. So I want you to take away from today that exercise, it's important to tailor your exercise. And if you are going to be exercising between now and next week, this is the time when you should stop exercising. So it's very commonsensical, but of course, heart problems can be one of the side effects of a lot of different chemotherapy agents. So if you have the signs of heart condition like shortness of breath, chest pain, irregular heartbeat, palpitations, unusual swelling in your ankles, face, neck or arms, please stop exercising, go see your doctor straight away. Low blood count, which is going to be a very common problem for you guys, and there's actually levels at which you should stop exercising, but for anemia, so low red blood cells, it's self-limiting really. So if you're anemic and that is the reason for your fatigue, which again I'm going to talk more about next week, you'll find typically if you go out for a walk and you start walking, it's just a matter of getting out the door and you feel a lot better for moving. If your blood count is really low, if your red blood cells are low, if you actually have anemia, you get out the door, there's no feeling better. You just feel terrible and heavy, and it's, as I said, self-limiting. So in those instances, it's really hard to push through that fatigue. Obviously, if you have a high temperature, you shouldn't be working too hard because that could be a sign of an active infection. If you have severe diarrhea or vomiting, if you do have any lymphedema symptoms and they flare up, and if you've got any really unusual cramping and severe weight loss all of a sudden, you should go see your doctor. So obviously, and this is really relevant to you guys, your energy will fluctuate and your exercise tolerance will fluctuate from day to day. So you're going to have good days, bad days, and just forget about it days. And that's really common, especially when you're undergoing treatment. So it's important to pace yourself, recognize what sort of day you're having, and don't be disappointed with yourself if you're not able to do what you could do last week or yesterday. Doing something is better than nothing, and having that routine. So perhaps on a bad day, you just might lie down on the couch and do some gentle stretching exercises and pumping your ankles and rotating your ankles and lifting your legs up and down. And there's plenty of sitting based exercises if you're feeling that you just can't, you don't have the energy to get up. I've had a lot of successful results in prescribing exercise, basically sitting down. You can do heaps of resistance exercise sitting down. So sometimes it's the change in posture that can really fatigue you. But it's all beneficial, and something I really want to accentuate, that rest and recovery is just as important as exercise. If you're not allowing yourself to recover from the exercise you've done, it's hard to improve. So if you're just getting out there and slogging yourself at the same level all the time and you just feel like you're not improving, perhaps you need to think about having, your exercise harder one day and much easier the next. And I also would encourage you, probably all of you, but I don't know your individual stories, but actually having a little lie down in the afternoon is really beneficial. Usually people like exercising in the morning and then having a rest in the afternoon. So I think, I've kept almost to time. So thank you. And I look forward to seeing you next week, but also I'm going to answer some questions now. But again, I'll let you know that next week we're going to go through what's involved in an initial assessment. We're going to do some tests to rate your strength and balance. Going to talk a little bit more about cancer-related fatigue and the common barriers of exercise and how to overcome them, and do some gentle exercise, and also perhaps how to find an exercise physiologist near you, which I can tell you right now if you'd like to know. Okay, thanks, Donna.
No worries. Thank you so much, Dale. It's some great information and really good research and data to show that the benefits of exercise and even with lymphoma diagnosis, because I know, when people are feeling pretty crummy, but this can help in the long run. So thank you so much. We do have a couple little questions, and if there's any more questions, please remember to add them in the quick Q&A box down the bottom. But we'll start off with this question that we've had sent in. Is there any evidence that overexertion, which causes stress on the immune system, can actually worsen lymphoma? Have you heard of anything to that?
So as I mentioned in the talk there's certainly a point at which you can do too much exercise, which reduces your immune competency. As to what that does to the lymphoma itself, I don't know, but I can only extrapolate that it's not a great thing, because we want our immune system to be as good as we can get it to help fight this. So
I think it would benefit more than the risk of causing any more damage, that's for sure. But also, I guess it's timely, just for people to talk to their doctors as well, just to ensure that and don't need a health check or something before they get started on strenuous exercise after treatment too. Is that what you usually recommend?
Well, I mean, you can get started. It depends on the level of exercise, and that's why it's important to see an exercise physiologist to work out what is the right level of exercise for them at the time, and how they're responding, and also, their exercise history, and that sort of thing, what they're used to and what is too much for them.
I guess you might be going through this next week a little bit, but maybe explaining a little bit about the role in prescribing exercise from an exercise physiologist. I
am going to go through that next week, but I'm happy to talk. I'll just touch on it briefly. So we do a really detailed assessment on someone, looking at all their all their components of fitness, strength, cardiovascular fitness, and goals and history, and what someone wants to achieve, and then prescribe an exercise program according to all those findings and the goals. And then someone might want to do those exercises at home if they're immune compromised, or they come into a group, or they take it to their local facility or whatever. And then we check in. How we run it is we usually do a reassessment every 3 months, and also we check in with people to progress that program appropriately for them and according to what's going on with their treatment and things.
And that sounds great. That's because we'll get to a bit of introduction for what's coming next week. That's great. Thank you. And I guess that sort of answers maybe Debbie's question, where she sounds like she's got some terrible leg pain. So, and how long will it take to get her up from walking from seeing an exercise physiologist? And I guess that's, again, looking at the patient's history of what's concerning them and prescribing exercise around her ailments.
So Well, I'd want to know what's causing the leg pain, but it is really common to have this myalgia, this muscle pain, not only from treatment, but from deconditioning. And when you do start getting moving again, people often forget stretching. And I've been getting really awesome results with people in reducing that pain through exercise and stretching. So strength followed by stretching and dynamic warm-ups. So often people get, pain. They find that they can't walk up a hill because they're getting leg pain. So it's a matter of warming up, walking on the flat for a little bit, stopping, stretching, and then trying to carry on. And that really can help alleviate that pain.
Good, yeah, finding out the cause is always a good start.
Yes, absolutely.
Gay was the saying that she was told actually not to do any strength exercise. So can you just explain a little bit what classifies as strength exercise for those who are unaware?
Well, I'd love to know why you weren't told to do strength exercise. Maybe there is a justification for it, but I'm not sure why that person was told not to. But strengthening exercise, I mean, that can be sitting and standing out of a chair. That's considered a resistance exercise, a strength exercise. So I would hate for anyone to be told not to get up out of a chair. Because it improves your functional life. How do you get off the toilet? How do you get out of bed? How do you get up from sitting down? So perhaps if someone was told not to do overly strenuous weight training, maybe they were doing Olympic clean and jerks or something. That's the one end of weight training and resistance exercise, and the other end is doing functional movements that helps us with our daily lives, and we can do really simple things with TheraBands and even cans of tomatoes we can strength train with. So it just depends where you're at and what you're trying to achieve.
Yeah, no, that's great. You're right. It's just just putting a little bit more weight into your joints and getting them working a little bit more. Yeah.
Yeah.
Carolyn has asked, how do you know when too much exercise is too much?
It's pretty much comes down to your recovery. So how well you recover from your exercise. So I'll write myself a note here that I will talk about next week. I'll get a good slide up about that, about intensity. So we talk about if you can recover immediately. So say you do a series of exercises and you feel about 10 minutes after you've done that exercise, you feel like you could probably do it again. And when you wake up the next day, you feel pretty well normal. You know that exercise was like a good starting point, for example, and a pretty moderate intensity level or even light level for you. If you feel like you need, a full 10 minutes to recover, you're feeling pretty exhausted the next day, or maybe you need an hour to recover from that exercise or 3 hours to recover from that exercise, you've done it too hard. And then the next day you feel absolutely shocking, you've done it too hard. So it all comes down to the immediate recovery straight after the exercise and also the recovery next day.
Excellent. Gay just mentioned that, was talking about, weight training as such. So, probably just calm down on that one a little bit until you're ready with the
so possibly it's got to do with, if you've got low platelets, you shouldn't be doing anything that involves impact training or jumping or boxing if your platelets are low, because you can bruise really easily and that sort of thing. So that may be why. Okay. And if it's really heavy weight training,
yeah, and that's probably a good point as well. Things to avoid when you, especially in the middle of treatment, would be high impact or combat sort of
yes,
exactly. Exercise that's going to be causing some bruising and problems.
Exactly. Yeah.
Doesn't look like there's any more questions as such, but I guess thinking about going into next week's session, I guess for people who, there was a few people there, I know you mentioned it briefly, but going into next week's session, what's some things that they can do to start working on their exercise? They've gone from pretty much doing very little exercise, and some of these patients online are probably just finishing treatment or in the middle of treatment. What can they do to get moving, and we can learn a bit more next week?
So, I mean, walking, as I said, even though that's what everyone's been doing during ISO, although you're all around the world, you're probably not all as isolated as us Victorians, but all around the world, all around Australia.
Is our world at the moment.
Yeah, it is, exactly. So between now and then, until I show you correct technique for stretching and resistance, even starting walking, so trying to build up to, walking, say, 5 minutes every day. It depends where someone's at right now. It's hard to say. So between now and then, perhaps someone could try and add on 2 minutes a day or 20% every couple of days to what they're able to walk. Although that would be a big jump for someone that's already managing 30 minutes a day. So
maybe getting out to the mailbox a couple of times a day is sometimes a lot for some people, and others maybe mapping out even around your block, if it's just a little block, that is. Slowly increasing it. At least it's a short distance. You can maybe do 2 laps the next couple of days or something. So but usually we do aim for about a 20% increase every couple of weeks. So doing that every day would be pretty vigorous, but it just depends on where someone's starting. Yeah, that's some great. So we do have a question in here. So from Scott, has been diagnosed with CLL, or chronic lymphocytic leukemia, a couple of years ago, and has mild fatigue and shortness of breath. Why is it he can ride 5 kilometers or run around and play touch footy for a couple of hours, but get out of breath when he just walks up a flight of stairs? Can I relate to that?
It's probably I would say it's the intensity at which you're walking up the stairs. Maybe slow down a bit. That is interesting though. Is there enough oxygen in your stairwell? And also the bike riding, that's more at a moderate intensity for you. Whereas the walking up the stairs is it's more intense. It's an intense movement. Yeah.
That's fair enough.
And it's something I guess you'd be used to walking up and down stairs though. So yeah, interesting.
Probably depends what you've done earlier in the day as well. You might be getting to that exercise tolerance part.
Yeah. Yep.
Oh, excellent. I don't think there's any more questions for us at the moment, but that's some great information for us to think about for the next week. And we really look forward to you joining us again next week. Thank you so much, Dale.
You are very welcome. Thank you for having me. And
thank you everybody for joining us today.
Yes, thank you.
We'll see you again at 12:30 next Wednesday. If you haven't read it already. Let me know on the nurse support line if you have any questions in the meantime. See you later.
Yeah, that'll be great. Thanks.
Thank you.